Hello everyone, welcome to your lecture on analysis and nursing diagnoses. This is the second step of the nursing process. These are the learning objectives we will be covering. Please go ahead and review the readings assigned in your Canvas module. What is diagnosing? Diagnosing is the second step of the nursing process. It identifies how a person, group, or community is responding to an actual or potential problem. It also identifies factors that contribute to that problem, the etiology, and it identifies resources or strengths that that person, group, or community can draw on to prevent or resolve the problems. Now, the important thing is that when you're making the diagnosis, a clear label or term that is familiar to all members of the healthcare team is important to understand the patient's needs. So consider a patient who's breathing rapidly. This patient could be breathing rapidly because he's angry, or this patient could be breathing rapidly because of a physiological reason. So the terms anger or impaired breathing are terms that will prompt the nurse to consider similar problem areas. So for example, anger is an emotional and behavioral issue versus breathing impairment, which is a respiratory issue. So using standardized terminology provides diagnostic clarity so that all the members of the healthcare team understand the patient's problem and can communicate effectively about them. Diagnoses are of different types. You have medical diagnosis, which only a physician or advanced practice nurse can do, like a nurse practitioner. Now, this medical diagnosis identifies a disease. So the doctor will order tests or diagnostics like an X-ray or assess physical signs and symptoms. And for example, they'll diagnose a patient with pneumonia, right? This is something a nurse cannot do. It has to be a physician. Now, a nursing diagnosis is a clinical judgment made by an RN that describes the patient's response to that diagnosis that the physician diagnosed, right? So how is the patient responding to, for example, the pneumonia diagnosis, right? So it is a diagnostic label that classifies an individual's, family's, or community's response to illness so that all nurses understand a specific patient's healthcare needs. This helps the nurses to identify nursing diagnoses by analyzing assessments, data, and recognizing patterns of data associated with a specific problem, so that they can treat the patient's responses or health conditions. So, for example, the patient who was diagnosed with pneumonia by the doctor, the nursing diagnosis would be shortness of breath, right, or impaired gas exchange or ineffective breathing patterns, or the way this patient responds to that disease. A collaborative problem is one that requires both medical and nursing interventions to treat. Nurses practice with other healthcare professionals to manage certain types of collaborative problems. This involves using physician-prescribed, therapist-recommended, and nursing-prescribed interventions to minimize complications. For example, in a case of a patient who enters a clinic with an infected leg wound, the patient's healthcare provider, the doctor, prescribes the antibiotic, the nurse monitors for fever and provides wound care, and a registered dietitian recommends an appropriate therapeutic diet. So it's a collaborative effort. Here on this table, you'll see the example of pneumonia. Please go ahead and review this. It will help you understand diagnoses a little bit better. The terminology that we use for nursing diagnoses should be standardized. Having a standardized nursing diagnosis allows nurses to specifically identify and discuss patient problems, no matter what settings they work in. It also contributes to effective healthcare team communication, right? Standard terminology is a key component of electronic health records. When practicing as a nurse, it's important for you to know that nursing diagnoses classification systems that are used in your agency or your nursing school. So this is a list of recognized and reliable nursing diagnosis classification systems. The two most common are the ICNP and the NANDA. And then we also have the nursing intervention classification system, and then we have nursing outcomes classification system. So these are the four that we will focus on. But for the diagnostic statements, the ones we will work with are the ICNP and the NANDA. So what are the steps of diagnostic reasoning? You assess the patient's health status, provide information for the database, all your assessment that you did, your health history, patient interview, physical assessment, all of that. You gather the data, your subjective and objective data, right? And then you validate the data with other sources. Make sure that the data is valid. Then you decide, okay, do I need additional data, or is that enough to complete the database, right? If you need additional data, then you go back and reassess the patient. If not, then you use the data that you have. Then you cluster that data into patterns and groups of signs and symptoms, then classify and organize it to make sense of it, right? Then you look for assessment findings and related factors. Then you look at, okay, what are the findings? What are the related factors? Why was the patient having these problems? You're going to think of all of that. Then you're going to identify the patient's needs. Now, based on what you collected, based on what you observed, this is what the patient needs. Then you formulate a nursing diagnosis. Now, we use critical thinking and our clinical judgment in all steps of the nursing process, in all aspects of nursing. So what does that involve, right? It involves data clustering, finding patterns, interpreting the data, the different types of diagnostic statements, formulating the diagnostic statement, making sure that it's valid, then prioritizing. Once you have your nursing diagnoses, you might have 2 or 3, then prioritize which is the most important or which is the most urgent, right? Then you look for any errors in your diagnosis. And after that, then you can plan interventions, which we'll cover in the next lecture. So clustering and interpreting the data. What do you do in this case? You identify significant cues. You cluster the cues, you identify any inconsistencies, you look for patterns, put labels on those clusters to identify the patient's response to the health problem. How is the patient responding, for example, to the diagnosis of pneumonia? What signs and symptoms do you see? So those are, that's what you're going to put a label on and cluster the data. Then you're going to select a nursing diagnosis either from NANDA or ICNP. Those are the ones that are valid and reliable, or whichever one your agency, the hospital you're working in, uses. And this is an example of, how the nurse may use assessment findings to diagnose a patient. Please look over this diagram. It will really help you understand the concept. Now, what are the different types of diagnostic statements? You have problem-focused negative diagnoses, right? So this basically means these are undesirable responses to a health concern that the patient has, right? For example, acute pain or impaired skin integrity or urinary retention. All of these are negative diagnoses, problem-focused. There's a problem there, so it's a negative response the patient is having. Risk nursing diagnoses. These are when the patient is at increased potential or vulnerability for developing a problem. For example, risk for fall, risk for unstable blood pressure. So these are risks, right? So, for example, a patient gets admitted to the hospital, you do a Morse fall scale, right, to see their chance of falling. And then you observe the patient and you say, okay, he's a little impulsive, so then you say, okay, risk for fall. That's your diagnosis. So now the patient hasn't fallen yet. It's still a risk, right? Then you have a health promotion diagnosis, which is also known as a positive diagnosis. So this is identifying a desire to improve health status or readiness for enhanced relationship, positive family support. So these are all health promotion diagnoses or positive. So the patient hasn't had a negative response to the health problem yet. Now, how do you formulate the nursing diagnostic statement? It's a 3-step process where the third one is optional, but I'll explain it. The first one is the diagnostic label. Use the NANDA or the ICNP or whichever classification system your hospital uses to come up with your nursing diagnosis first, right? For example, acute pain or anxiety or, whichever one you choose to pick. Then once you pick one, then you're going to look at the related factors. Okay, the patient has acute pain related to what? What's the etiology of this diagnosis, right? So you can say acute pain related to, a surgery that the patient just had, and he has an incision. So that's your related to factor. Right, so this is where you would list the cause of the nursing diagnosis. What led you to choose this? So NANDA has 4 groups. They have pathophysiological, biological or psychological, treatment-related, situation-related, or maturational. For example, anxiety related to a lack of knowledge of a scheduled surgical procedure. So anxiety is your diagnosis, and as related to lack of knowledge of a scheduled surgical procedure. So that's your related to factor, right? And then you have your risk diagnoses. So this is, once again, where the actual problem hasn't happened yet. This is a risk diagnosis. So the patient is at a risk for falling. Over here, you're not going to have related to factors because the problem has not happened yet. Then the third part of it, which is optional, is you can add any major assessment findings that you had. For example, you can say anxiety related to lack of knowledge now of scheduled procedure as evidenced by. That's where you add your major assessment findings. Is as evidenced by patient stating, I am scared about the upcoming surgery, or anything else that you feel is a major assessment finding related to your diagnoses. And we'll practice more of these as we go on. So these are some examples here on this slide and this slide. Please go review them. It will really help you to understand, how a nursing diagnostic statement is formulated, how it's written. For example, let's look at one over here. It says anxiety, right? Anxiety related to uncertainty over surgery. What are your assessment findings? As evidenced by patient asking, what type of pain will I have? Or as you can say, anxiety related to uncertainty over surgery, as evidenced by restless and unable to sleep, right? So this is how you formulate your nursing diagnostic statement in 3 parts. And the first 2 are the mandatory ones. So now once you collect your data, subjective, objective, assess your patient, do your physical assessment, come up with your nursing diagnostic statement using the NANDA or the ICNP, then you will prioritize your diagnoses to see, okay, which of these is more urgent, right? So placing them in order of importance, rank the problems based on urgency. You can have high priority, which is life-threatening, medium priority, which does not pose a direct threat, or low priority, right, which requires minimal supportive nursing interventions. You can use Maslow's hierarchy. This will help you to, prioritize. And as a new nurse, sometimes it's very difficult to prioritize. You could always ask other nurses who you work with who have been nurses for a while and get some, insight into prioritizing as well. Here's a quick clinical scenario. Please read over it. It will show you how the critical thinking process in prioritizing, the difference between prioritizing between a new grad nurse and a expert nurse. What is diagnostic validity and diagnostic error? So once you come up with your diagnostic statement, right, you use NANDA, ICNP, then you come up with your diagnostic statement using the 3 steps where you have your diagnosis related to, as evidenced by. Now you check for validity. First of all, is it accurate and approved diagnostic statement? Is it an official one from NANDA or ICNP? Okay, once you have that, then you're done with that one. Now, diagnostic statements, your diagnoses, can have errors, right? What causes these errors? It could be data collection. You have inaccurate data or you're missing data. So you might have to go reassess your patient and collect more data. Another reason why errors can happen is in clustering of the data and organizing of the data, right? And this can be because of premature clustering of data. That means that you didn't collect enough information and then you started to organize the data and you don't have enough to organize. Or you can have errors because of in analysis and interpretation of the data. You had insufficient data, you didn't cluster it correctly, and now you can't analyze it because of that same reason. So the fourth reason why you can have errors in your diagnostic statement is lack of appropriate, concise, and precise language. What does this mean? It means that sound clinical reasoning enables you to make the judgment needed to identify an accurate nursing diagnosis. The process will lead you then to select interventions that are specific to that diagnosis. So successful selection of nursing intervention also depends on having the correct related to factors or risk factors for that diagnosis. So an accurate diagnostic statement with relevant assessment findings guides you to selecting, appropriate and individualized nursing interventions. So how can we avoid these errors? Patient's response to a health problem, focus on the patient's response, not the medical diagnosis, because that is inappropriate. For example, instead of your diagnosis being hypertension, select altered blood pressure. That is within your scope. That's altered blood pressure is a nursing diagnosis. Hypertension is a medical diagnosis. For example, think of it, right? If you picked hypertension as your nursing diagnosis, right, what can you do about it? There's nothing you can do about it because the doctor has to prescribe the medication. The doctor has to diagnose it. You cannot diagnose it. But if you have altered blood pressure, if it's high or low, then you can say, okay, my intervention is going to be to administer antihypertensives that the doctor ordered, right? Another way we can avoid errors is to focus on the diagnostic statement rather than a symptom, right? Identify nursing diagnosis from a cluster of assessment findings, but not just a single symptom. One assessment finding is not enough to come up with a diagnosis. For example, dyspnea, which means difficulty breathing, alone doesn't lead you to a diagnosis. You need to have more data, right? So to prevent errors, you need to have more data. So you can say, find dyspnea, reduce chest expansion when they're breathing rapidly. These are all assessment findings that can lead you to a nursing diagnosis of impaired breathing. Another problem is when you need to focus on, the problem caused by the response to a treatment or diagnostic, statement. So identify a problem caused by a response to a treatment or diagnostic study rather than the treatment or study itself. Once again, it's important to remember that, your focus is the patient's response, the patient's experience, not the disease or the diagnostic test or the, something else. It's the patient's response. For example, let's look at it. The patient has chest pain and is scheduled for a cardiac catheterization. Possibly has a nursing diagnosis of anxiety related to the lack of knowledge about cardiac testing, as evidenced by the inability to describe cardiac catheterization after repeated questioning. That's the correct way to put it. Now, an incorrect diagnosis would be anxiety related to cardiac catheterization. Right? So now you're focusing on cardiac catheterization, not the anxiety that the patient is having in response to it. So I think I skipped the risk factor one. So related risk factor, focus on related factor or risk factor that's treatable through nursing interventions. For example, a diagnostic test or chronic condition is not a cause that a nurse is able to treat. A patient with fractured ribs probably has pain when inhaling, impaired chest expansion, and slower, shallow respirations. A chest x-ray may show a collapsed, lung in that area. So the nursing diagnosis of impaired breathing related to shallow respirations is incorrect, right? There are no interventions that directly make respirations less shallow, right? You can't fix the patient's lung problem, right? But the diagnosis of impaired breathing related to chest pain from rib fracture, evidenced by reduced expansion and difficulty breathing, is correct. So now your nursing intervention is directed towards the pain relief that will help them breathe better instead of the collapsed lung. Okay, so now let's move on to the next one, which is identify a patient response to the equipment rather than the equipment itself. So patients are unfamiliar with medical technology and its use. So the diagnosis, for example, you look at the diagnosis, lack of knowledge regarding the need for cardiac catheter monitoring related to inexperience. Now that's accurate. Inaccurate would be lack of knowledge related to cardiac monitoring. Because over there, you're focused on cardiac monitoring, you're not focused on the lack of knowledge that the patient has related to it or the inexperience that they have, right? So the next one is identify a patient's problem rather than your problems with nursing care. Nursing diagnoses are patient-centered and form the basis of care. So consider a patient with the IV. So potential diagnosis of potential IV complications related to poor vascular access. Can you improve the patient's vascular system? No, you can't, right? That's a nursing problem, not a patient problem. So if a nurse has difficulty putting in an IV, she can get help from somebody else who can put it in, maybe has more experience in it, and they can come put it in, right? So that's your problem as a nurse, not the patient's problem. So the correct diagnosis would be risk for infection, evidenced by swollen IV site, pain at site, and slowed infusion. So now you can fix those problems. You can fix the pain at the site. You can, the swollen IV site. Then okay, we need to get a different IV placed into the patient. So now you're focusing on the patient. Then we have identify a patient problem rather than the nursing intervention. So you plan nursing interventions after you identify a nursing diagnosis. The intervention of offer bedpan frequently because of incontinence is not a diagnostic statement. That's an intervention. That's something that you're going to do. That's not your diagnostic statement. Instead, with the proper assessment data and the correct diagnostic statement would be diarrhea related to food intolerance, evidenced by 3 stools daily and soft form stools. So a correct diagnosis will more likely result in selecting appropriate interventions. So you basically set the diagnosis decide on the diagnoses first, then you decide on the nursing intervention. Another one is identifying a patient's need rather than the goal of care. That's also very important. For example, change the goal phrase statement of patient needs high protein diet related to potential alteration in nutrition. That's a goal, right? It's not a nursing diagnosis. Instead, you can say impaired nutritional intake related to difficulty swallowing, evidenced by inability to eat solid foods and pain in the mouth. Another one is make professional rather than prejudgmental statements. Base your nursing diagnosis on subjective and objective data, patient data, and do not include your personal beliefs and values in it. For example, impaired skin integrity related to poor hygiene habits. Now you're judging the patient, right? You're saying, oh, they have poor hygiene habits. That can't be in your nursing diagnosis. It's not a professional way of putting it, using it. So what you instead should say is impaired skin integrity related to inadequate knowledge about perineal care, as evidenced by inability to cleanse perineum and inability to explain cleansing techniques. That is more professional. Avoid legally inadvisable statements. For example, acute pain related to insufficient medication. Why is there insufficient medication? That's illegal, right? So you don't want to put statements like that in there. Your nursing diagnosis should be acute pain related to insufficient knowledge of analgesic scheduled, evidenced by patient's self-report of pain intensity and inability to describe their dosage plan. So that's the proper way of doing that, for phrasing that. Another one is identifying the problem and etiology to avoid a circular statement. So don't make your diagnostic statements circular, right? For example, impaired breathing related to shallow breathing. That doesn't even make sense. It's like a circular statement. You're not really clarifying what's going on with the patient. Instead, you can say impaired breathing related to incisional pain, evidenced by splinting and increased respiratory rate. So now that's more clear. Then finally, we have identify only one patient problem in the diagnostic statement. Don't put 2 or 3 in there. For example, pain and anxiety related to difficulty in ambulation. Now you have pain and anxiety in there. So if you gave the analgesic and the patient doesn't have pain anymore, you solve the pain problem, but the anxiety is still there, right? Instead, you can focus on only put one diagnosis in each of your diagnostic statements. Okay, so care planning, your diagnosis, whatever you come up with, is what's going to direct your plan of care. Now that will lead to nursing interventions, using the nursing intervention classification, and nursing outcomes. So that your diagnosis is very, very important because that's what's going to lead to everything else. Then we have documenting your diagnosis. Communicate accurately and in a timely manner. Don't delay your charting. Document your nursing diagnosis as soon as you can. When receiving report, confirm the diagnosis. For example, when you're coming onto a shift and the nurse is giving a report, confirm the nursing diagnoses and make sure you communicate any questions you might have. Or if you're giving a report, communicate the progress at the end of the shift. If the patient had pain and your nursing diagnosis was acute pain and you gave them an analgesic, now that's not current anymore, right? You took care of that. So make sure you give the oncoming nurse any updates. Now collaborate with the healthcare team. It's very, very important to always collaborate with the healthcare team and convey your patient's problems to them. Document priority information in the current plan of care. Make sure everything is current and up to date. Okay, and the next step would be the planning phase and outcome identification phase. And this is it for your diagnosis.